Hi everybody, my name is Sarah Buckley, and here's my video to introduce myself. I was born and raised in Marlborough, Massachusetts. I've basically lived in Marlborough, Mass my whole life, all 27 years. I went to school at St. Anselm College, which is in Manchester, New Hampshire. I got my Bachelor's of Science of Nursing in 2015, and I've been a nurse for 5 years. This is my family. On the very far right of the screen is my family. I have identical twin older brothers and loving parents. My mom works as a guidance counselor and my dad is a salesman. In the middle is my future family to be, my fiance Alec on the far left, and that's his family in the middle. He has two brothers and also has loving parents and a sister-in-law. He also has two nephews and a niece that will also become my family. On the bottom left is my niece. Her name is Cecilia. She's the first grandchild on my side of the family. Both of my brothers are married and we have just Cece. For hobbies, these are my three fur babies. Most of my time when I'm not working or not doing schoolwork revolves around them. I have two Great Danes. This is Trevor on the far right. He's 2 years old. This is J-Rock on the left. He's a new puppy that we just got recently. He's about 4 months old. And then in the middle is our English Bulldog. His name is Wedgie. We adopted him this past year. He's going to be 7 years old in November, and he is quite the looker. I love my dogs with all my heart. I spend all my time with them, and when I'm not spending time with them, I like to hang out with my friends, my family. Also planning a wedding during COVID's been a little hectic, but it's something you got to do. And I also like to go on runs. I like to read for fun as well. A random fun fact about me is that two of my best friends from my undergrad program from St. Anselm College are also in the Regis program with me. We're on track to all graduate again together and get our nurse practitioner licenses. So I've been a nurse for 5 years. I started working at Massachusetts General Hospital right after I graduated. I worked in what's called the Center for Perioperative Care. It was both pre-op and post-operative care that would send patients home, same-day surgery. After working there for about 3 years, I moved to working to Women and Infants Hospital in Providence, Rhode Island. I worked in their NICU for about a year. I've always wanted to work in the NICU, but it was difficult to transfer into Mass General's NICU without having any experience. So once I worked at Women and Infants for about a year, I went back and I'm now back at Mass General working in their NICU. It's a lovely place to work. I love all of my colleagues and I can't imagine working anywhere else. So I'm on track to obtain my pediatric nurse practitioner license. I can't imagine working with any kind of patient population other than children. I love working with my babies and working with their families to reach their goals and get babies to be healthy and go home with their parents. I definitely want to continue working with a pediatric population. It's been a passion of mine and I can't wait to get my nurse practitioner license. So career goals, I really would love to continue working in the NICU specialty. I have a desire to work in a follow-up developmental clinic for NICU graduates. Once these babies are discharged from the NICU, they require special follow-up. So Mass General has a follow-up clinic that I would love to work in someday so I can see how the babies that I take care of progress and how they do once they're out of the NICU. I look forward to working with everybody this semester and thank you for listening to my presentation.